So here you can see tooth structure. This mandibular molar, first molar, it is carious and pulp so deep to involve the pulp, and then the pulp infection. You can see area of this distal root, and around the mesial root there is some radiolucency, and this indicate that there is some infection involving what the area what called the periradicular area, which surround the root apex. So this is tooth structure is damaged, and here you can see in another picture that it is the root treated. Root canal treatment has been done and the restoration is placed. Now tooth, you can uh, treat the diseases which involve the pulp and periapical area, restoration the tooth, and the tooth is again functional. So this is the main objective of your endodontic treatment and function. Here again can see here some sinus involved, this extraoral sinus of this patient, and the draining sinus pus is coming from this. So due to the periapical tooth infection of this mandibular anterior tooth, it's a canine which is infected. Here you can see radiolucency involving the periapical area again, and pulp is damaged. When you take the vitality of this tooth, it will not respond to your vital taste like your cold, heat, or your electrical pulp testing. So when you apply this, all these things, pulp will not respond. Normal pulp will respond when you apply any heat or cold or electrical pulp testing. So in if it is not responding, means it is the pulp is necrosed or dead. In this dead pulp, it is infected, and through the periapical foramen, which is present at the root apex, it communicates with periapical area, and all the your infected uh, your the bacteria and all these things uh, through the periapical foramen involve the periradicular area, and that so when you do the root canal treatment, you can see a healing of the periapical area and healing of the sinus as well. So this is how you can treat the periradicular diseases as well, which is actually initiated by the pulpal infections. Again, the root canal treatment of the seriously damaged tooth with pulpal involvement, with the periapical involvement, and the restoration. You can see root canal treatment and restorations. The basic of the phases of the endodontic therapy can say a diagnosis. You have to diagnose. There are अभी आपने पढ़ा होगा या अभी हम आपको पढ़ाएंगे different pulpal condition, the reversible pulpitis, irreversible pulpitis, and there are the necrotic pulp as we discussed. There are four pulpal status actually: the normal pulp, and the irreversible pulpitis, and the necrotic pulp. एंड अगेन पेरिएपिकल जो डिजीजेस होती हैं वो भी देयर आर डिफरेंट क्लासिफिकेशन और द डिफरेंट टाइप्स ऑफ द पेरिएपिकल डिजीजेस. फॉर एग्जांपल acute periapical periodontitis, और जिसे हम कहते हैं symptomatic apical periodontitis, जो symptoms हो, टेंडर हो और पेन एंड बाइटिंग हो, there's all tenderness उसमें, that is we call symptomatic apical periodontitis. Then there's the asymptomatic periapical periodontitis, where there's a radiolucency is present but there is no symptoms, and there could be a abscess, what we call the acute abscess. And abhi humne sinus dekha, so that we call the chronic abscess, acute abscess. So there are different types of the periapical and different types of the uh, pulpal diseases, because mostly pulpal diseases जो symptoms होते हैं, it could be mainly the pain. So there could be a pain. The reason could be non-endodontic. as you know, the facial pain and all these things. There are so many different reasons of the pain. So you have to do a proper diagnosis before doing the treatment. So whether it is an endodontic problem or it is a non-endodontic problem, it could be a periodontal problem, could be another problem. So you diagnose is the main thing. Once you diagnose a case, then you have to preparatory phase, and then your obturation or filling phase, and then finally there is the restoration. Here you can see in all these three things, tooth is well involve a diagnosis, and then access is made, because you have to in endodontic means you have to remove the pulpal tissues, whether it is necrotic or in case of irreversible pulpitis, you need to make the access cavity to open the pulp chamber, which is present at the mostly in the coronal part of the tooth structure. You have to make and remove the dentine, which is present over the pulp chamber. The dentine should be removed to open all the pulp chamber, and then through the pulp chamber can find the canal orifices, opening of the canals, and through these file system you have to remove the pulp tissues and the contents of the pulp. So clean the pulp area, canals, disinfect the canals, because the purpose of cleaning is to disinfect the canals, make the canals free of the bacteria, and then sealing of the canal, what we call the obturation of the canal, because canal sealed, so there could be no chance of the reinfection. So these all things or they looks very simple, but it's so difficult sometimes to perform. That we call the endodontic triad. What's called debridement and disinfection and sealing, because these three things are mainly determine the success of your root canal treatment. Debridement and disinfection diagnosis again, as I told you, but the debridement and disinfection make the canals free of the bacteria. The purpose whole, it is not possible to 100% bacterial free हो, but the most of the canal become should be disinfected. You disinfect it. अभी आप पढ़ेंगे आगे, there are two methods, mechanical and chemicals, and medicaments as well. Mechanical, using the files and everything to mechanically remove the pulp and contents of the pulp from the pulp canal, and then disinfection, used some chemicals to irrigate the canal up, solutions, chemicals like your sodium hypochlorite, we inject inside the canals, that it cause a disinfection of the killing the bacteria inside. And sometimes we use like intracanal medicaments like your calcium hydroxide, chlorhexidine for few days inside the canal to temporarily sealing the cavity. So leaving the intracanal medicaments inside the canal. The purpose is to again to kill the bacteria and make the canals free of the bacteria. So this is the main purpose. If you successful to make the canals free of the bacteria, there will be a good prognosis of that tooth structure, that endodontic treatment. And then sealing, of course, if you seal it properly, what we call the three-dimensional sealing, then it is again the failure of tonsil will be reduced. Sealing, ectoperiapical lateral sealing, and then coronal sealing as well as very important. The coronally, it should be sealed properly, so there should be no leakage, and then the treatment will be successful. So when you select जैसे शुरू में भी हमने डिस्कस किया कि it is very important to know the whether tooth will be functional or it will be not functional, whether we have to go for extraction of that tooth or will go for root canal and all these things, क्योंकि root canal एक somehow it's extensive and expensive type of treatment. So it should be decided before root canal treatment. if your tooth is could be saved or could not be saved. So if there is some endodontic problem, अभी हम आप पढ़ेंगे the difficulty of endodontics, how sometimes it's make more difficult that we cannot perform the endodontic treatment. For example, some root lacerations, some anatomical problems, some, so negotiation could not be possible. So canals are calcified, and all these other problem could be we discuss करेंगे जब हम आपको पूरा ये पढ़ते जाएंगे. So difficulty case, if it's the most difficult case or sometimes not possible to perform the endodontic treatment. Restorative problems, you have to check the restorability of tooth structure, the coronal tooth structure, how much it is sound available after removing the caries and all these things. Sometimes the tooth is more deeply or advanced damage to tooth structure due to the caries, and almost all coronal tooth structure is damaged. So even you can do the roots are there, what we call the BDRs, broken down roots are there. That root can do the root canal treatment, but the tooth can be not be restored. So that tooth can do, should be extracted. So restorability should be checked before doing the endodontic treatment, that if the tooth is restorable or tooth is not restorable. Third thing is more important, the periodontal problem. You have to check the periodontal status of that particular tooth जिसकी आप रूट कैनाल करना चाह रहे हैं कि पेरोडोंटली साउंड है कि नहीं है, पेरोडोंटल डैमेज कितना है, पेरोडोंटल अगर डिजीज है तो वो ट्रीटेबल है नहीं है. सो पेरोडोंटल अगर प्रॉब्लम है तो कितना एडवांस है. So tooth can be saved, जैसे डिस्कस किया शुरू में ही कि there is advanced root bone resorption with a 3 degree आपका mobility है. So prognosis could be, questionable. So these things you have to check before doing the root canal treatment. For here, you can see here in periodontal bone loss, though the tooth structure is available and bone advance, it is not so much advanced at the periapical area, but these are things which make the prognosis in terms of the um, uh, longevity of tooth is questionable. So these things should be, because there's a heavy restoration. If pulp is involved, pain is there, and your diagnosis that the irreversible pulpitis, but the periodontal problem is also there. So it is depend the root canal treatment, the success of the depend upon not only the endodontic treatment but the periodontal treatment as well. As here you can see area root radiolucency, but it is due to that endodontic problem, so could be treated with endodontic treatment. And this tooth structure here you can see this heavily raised or molar, but at the under this furcation area you can see root caries, root caries which is more deeply, and that make the tooth is not actually restorable. So if this restorability of tooth structure is questionable, so now here you decide that tooth should be extracted or tooth can be saved. So these kind of the things should be checked before. Okay. Sometimes the deeply carious tooth structure, again this prognosis of the is questionable. Here you can see a very uh, deep carious lesion involving the furcation or the floor of the pulp chamber, or very thin furcation जो फ्लोर होती है जिसको हम कहते हैं pulp chamber is very thin and could be perforated, and bone loss at periapical area, and coronal tooth structure is so much lost. So this is the restorability of tooth structure is questionable. So you have to decide now, okay, tooth should can be saved or cannot be saved. So this decision is important. जैसे मैंने कहा कि एंडोडोंटिक प्रॉब्लम्स होती है वहाँ जहाँ canal instrumentation cannot be performed. In that cases, again, we need to decide here in these cases if endodontic treatment, if not canal block है, canal calcified है, severe जो है dilacerations हैं, so that in these cases sometimes we can't perform the filing of the root canal, then extraction could be. There are other options भी होते हैं, depend करेगा case to case. This is like a vertical root fracture. Here in the premolar, you can see some what we call the split tooth when there is a fracture involving mesodistally, separating the tooth in two halves, in the palatal and the buccal halves. And these fractures are so deep and also involving the root area. And root is जो है वो also the fracture same. And pain हो सकता है क्योंकि pulp could be involved in all these things, but this could tooth cannot be saved once there is a vertical root fracture is there, so must be extracted. Non-strategical teeth, for example, your third molars, what sometimes strategically the molars are missing, so only third molars are there. So we need to save these lonely third molars because of processes purpose the for removable partial denture there या fixed partial denture, then they could be on abutment. So in these cases, sometimes we need to save the third molars and doing the root canal treatment, or otherwise it's difficult to get the root canal treatment of these third molars because of the accessibility. Sometimes they are not fully erupted, sometimes their anatomical position, the roots are so much fused, dilacerated, so it's make the difficult root canal treatment, but we can do sometimes in some cases. Third molar. Here you can see this premolar. It's making your. It is not impossible to do the root canal treatment of this tooth, but it is difficulty is much higher as compared to normal tooth structure. This premolar here you can see a very curvature, a double curvature is there, what we call the S-shaped curvature here, and the periapical area again a curve. Nowadays, we have some, rotary NATI files that can negotiate in these curved canals, but with the stainless steel files, it's difficult to get to get the canal, negotiation and cleaning, because purpose is to clean the whole canal from coronal to apex. So that is sometimes making difficult because of this, anatomical problems, but it could be negotiable. As here you can see it's a seal, but it's sometimes difficult. This is here again, see, you can see this molar, maxillary molar with the heavy restorations are there, and mesial root is acute curvature is there. Almost it's a 90-degree curvature is here, and doing root canal treatment of this is challenging. Is challenging. It had been done, but it is a very difficult and challenging. ठीक है, root canal treatment can also be performed in primary teeth as well, as primary earlier infection with the extraction it could be avoided because the loss of the primary molar, the consequences again. So it is better to save the tooth structure and tooth with जो इसका normal life span है. So by doing root canal of the primary molar, you can save it. Okay, nowadays we have an implant. So before you doing the endodontic treatment, you should know the, uh, as I told you, it is about the pulp and periradicular tissues. So I know that you know the pulp and little bit और उसकी biology और सारी चीज just थोड़ा सा मैं refresh इसको कर दूं ताकि you know the pulp. As you know the pulp, it is a vascular tissue or is what we call the connective tissue and vital organ which is present in your tooth structure, which contain the vascular cells and blood vessels, nerves, all these things. The tooth structure here you can see an enamel, dentine, and the pulp. Pulp has a two part. One we call in a coronal pulp spread in the crown of the tooth, and the radicular pulp mostly the canals, which call the canal, which present in the root canals, that we call the radicular pulp. And this radicular pulp aimed at the root apex. At the root apex, you can see a foramen here, which communicate through periapical area, which is area which surround the root apex, called the periapical area. And then if you अगर आप apex से बाहर निकलेंगे through the periapical area, so first thing we'll find the periodontal ligament, and then there is the alveolar bone. Very here clear the anatomy little bit of your pulp canal, and the coronal pulp we call the pulp chamber. As here mostly it's present what we call the trunk of the tooth at the pulp chamber, and pulp chamber have an extension into the coronal area under the tip of the cusp we call the pulp horns, and then the radicular pulp what we call the canals, root canals, in sometimes have a communication with the periodontium what called the lateral canals, but the main communication here at the periapical foramen, and from this periapical foramen all the blood vessels, nerves are coming inside. So this is the basic communication to the system, and around surround the tissue what we call the periradicular tissues, and all these things are simple. Functions of the dental pulp, as you know, functions are there. What we call the primary functions and the secondary functions. Primary functions are formative during the tooth formation. There is a dental papilla. That papilla form the pulp, and that also the source of the dentine, the आपकी जो odontoblast cells and all that cells differentiate from this dental papilla and make the dentine. So it has a formative role in that stage. Then there is a secondary roles as sensitivity, as all the nerves are present in your pulp. Even the dentine sensitivity is due to the presence of the nerves endings at the pulp. So the pulp have a sensitivity. If the pulp is dead or necrose, the sensitivity of tooth structure loss, or even some, if you doing the root canal treatment, removing the pulp tissues, the sensitivity loss. So sensitivity, sometimes it's better if indicating something wrong going on with the tooth structure, so that can be some efforts may be taken to save the tooth structure. Hydration of dentine, because of the fluid present in the dentinal tubules, that is actually the tissue fluid which is provided by the pulp into the dentinal tubules. So that make the dentine hydrated and moisture, and that is also pulpal. Defense, when there's any disease involved with the tooth structure, even involved enamel and dentine mostly when there's involved like your caries. As you know, the defense is initiated in terms of the more dentine formation, and that is your tertiary dentine or reparative dentine. All it is due to the odontoblast cells which present actually in the pulp. So these active and due to the disease and secreting the more dentine that can prevent that infection to move towards pulp. So that can be this is the defense function, all that pulp. So the pulp is important to the part of the tooth. So sometimes it is become infected, so could produce a problem. The development हमने discuss किया कि pulp have a dental papilla. Here you can see outer dental epithelium, inner dental epithelium. It is epithelial origin, but the dental pulp origin from the ectomesenchymal cells, which make this structure which called the dental papilla, and then the dental papilla is converted into dental pulp and provide the cells for the formation of the dentine as well. So this is formative, as you know, and it also a role of formation into the reticular dentine, the roots of the uh, teeth. As you know, the Hartwig root sheath, which initiated from the inner and outer dental epithelium, it's epithelial origin, which extended down in deeply, but with the dental papilla, which provide the odontoblast cells, and these odontoblast cells secrete the dentine along this Hartwig root sheath and make the roots of the teeth. So if it is, the tooth structure, tooth erupted, but the root is still completing, and it takes at least 2.5 to 3 years after eruption of the tooth to complete the root formation. So sometime when tooth is erupt and pulps damaged due to any reason, for example, trauma sometimes, if it is a trauma, it could damage the pulp and pulp become necrosed. So there's a no further root formation. The root formation is arrested because the pulp is dead. But pulp is a vital, root can be completely formed. So the pulp presence of the pulp is important because the source जो cells होते हैं जो dentine बनाते हैं of your root, वो तो pulp है. Yeah, a problem with the defense system in making the more secondary caries or the tertiary caries against dentine, sorry, against the caries, making the more dentine, and it causing the shrinkage of the pulp chamber due to the deposition of the dentine is more, and sometimes here you can see blocking of the even the orifices due to the more deposition of the dentine. So this is a function of the pulp. Histology of pulp, here you can see a pulp cells, important pulp cells, the odontoblast stem cells, and the fibroblast. Odontoblast cells are important cells. Here you can see a dentine, darker जो नजर आ dentine है. Then there is a thin line जिसको mental dentine कहते हैं, और वो non जो होती है वो नॉन कैल्सिफाइड डेंटिन होती है, और ये पल्प की बाउंड्रीज है. एंड ये सेल्स है जो these cells we call them odontoblast layer. So odontoblast layer present at the periphery, it's very close to the dentine, and these odontoblast cells are here are responsible for formation of the dentine. जो सेकेंडरी डेंटिन जो कंटिन्यूसली फिजियोलॉजिकल डेंटिन बनती है वो भी these cells. इस ओडोंटोब्लास्ट सेल्स के नीचे ही और सब ओडोंटोब्लास्ट सेल्स होते हैं. So sometimes odontoblasts cells could be killed like when pulp is exposed. So the subodontoblasts cells can be differentiated and matured to make the dentine. So these are the cells make the dentine. Here you can see a dentine, a pre-dentine or odontoblast cells layer. This is the odontoblast cell layer, and under this layer there is subodontoblaст cell layer. Then under this layer there is what we call the cell-free zone. There's a no cell in present, only the other collagen and blood vessels, but there's a no cell. Then the cell-rich zone, which you have cells other than odontoblast cells, like your most majority. This is the fibroblast cells, which make the collagen of the pulp. So pulp की जो bulk of the pulp है वो है collagen. So that collagen is spawned with this fibroblast cells, or then the core of the pulp which contain more major जो आपकी blood vessels होती हैं. So here you can see a dentine odontoblast process into dentine, pre-dentine जिसको हम कहते हैं, that pre-dentine non-calcified dentine which present in the between the pulp and the dentine, and it prevent the resorption of dentine from the pulp. So the pulp have odontoblast cells, and it is also odontoclast cells which can resorb the dentine if it is pre-dentine is not present. Then there is odontoblast cells. As here you can see a body of the odontoblast cells present very close, and their extension is present inside the dentine, what we call the odontoblast process. And there the nerve fibers close to the body of the cells of the odontoblast. There is a cell-free zone, and then there is a cell-rich zone, which are the other cells, and the nerves and fire, their vessels are present at the core of the pulp. इनर्वेशन ये मैं आपको हम पढ़ेंगे डिटेल थोड़ा बताऊंगा इन द केस जो सिस्टमेटिक जो आपकी ट्राइजेमिनल न्यूरल का पूरा ट्रैक है, जब हम लोकल एनेस्थीसिया पढ़ेंगे क्योंकि उसको एनेस्थेटाइज करते हैं, तो दैट विल बी मोर क्लियर इन दैट. इन पल्प में जो नर्व्स होती हैं, जो नर्व एंडिंग्स होती हैं, वो थोड़े से हम पढ़ेंगे क्योंकि उसमें हमें पता है क्योंकि पल्पल पेन समटाइम्स इज very severe, sharp, and sometimes it's a dull. So it is all due to the presence of the different nerve endings in the pulp. This is the classification of nerve fibers जो आपको पता है, and A alpha is a motor, and A beta is a pressure and touch. It's not present in pulp. Both. A gamma, again a motor. A delta, as here is A delta fibers. So A delta fibers present in your pulp, and that is the pain and temperature touch. Mostly all the other things, temperature हो या touch whatever, tooth का जो sensation it's all always in terms of the pain. So the pain ही हमें महसूस होता है जब heat या cold या everything जो भी है उस पे लगे, तो sensitivity या pain ही होता है. तो the A delta fibers are mainly present, and these A delta fibers present at the periphery, mostly periphery of the pulp. So initial inflammatory process जो आपको पता हो कि pain जो होता है it's mostly due to the cold, or sometimes heat when it become more deeper, and spontaneous pain, and pain is more sharp, more severe, and for short duration. So A delta fibers these are the myelinated fibers, fast conducting fibers, and present in the periphery of the pulp, and they are responsible for these sharp acute sensitivity or pain वो जो फील होता है हमें. प्री गैंग्लियनिक ऑटोनोमिक फाइबर्स इसमें भी इतने नहीं होते पल्प में, मगर सी डॉर्सल रूट पेन फाइबर्स होते हैं. एक जैसे मैंने कहा कि डिफरेंट टाइप्स ऑफ द पल्प पेन होता है कि एक डल टाइप होता है, थ्रोम्बिंग डल टाइप, एंड कंटिन्यूस टाइप पेन होता है. That is your C fibers pain, but the C fibers are mostly present in your core of the pulp, and when you more deeply inflamed pulp, mostly the A delta fibers तो जो है वो खत्म हो जाते हैं due to the pulp inflammation, but the C fibers are more resistant fibers and present even sometime the partially necrotic pulp and part inflamed pulp. So these C fibers are non-myelinated or in slow conducting fibers as compared to A delta fibers, and they are responsible for dull thrombing, that your continuous type of the pain. Sympathetic nerve fibers होते हैं because of their the nerves. So here you can see A delta fibers myelination, ये C fibers myelinated नहीं होते वो, और जो लोकेशन मैंने बताया कि पेरीफ्री होती है, और C fibers probably throughout the pulp होते हैं, मगर mainly at the center of core of the pulp होते हैं. A delta fiber sharp pricking pain होती है, और रिलेटिवली लो थ्रेशोल्ड पे भी पेन शुरू हो जाता है, मगर सी फाइबर्स आर बर्निंग एकिंग और लाइक दिस, वो जो लॉन्ग टर्म कंटिन्यूस टाइप पेन होता है. So this is the difference between the A delta fibers and the C fibers. These both type of the fibers are present or in the pulp. So blue आप देखें और green देखें, the distribution of the A delta fibers and the C fibers. So these are the at the A delta fibers mostly in the pulp horns are very sensitive. Pulp, जब when you open in the pulp chamber, pulp horns को touch करेंगे कि तो वो बहुत sensitive, painful होता है sometimes because of these A delta fibers present in that. और सेंसिटिविटी भी ए डेल्टा फाइबर्स, ये जो है हाइपर सेंसिटिविटी आपकी होती है डेंटिन की, ड्यू टू द फ्लूइड मूवमेंट, अदर इन द चेंज इन द टेम्परेचर, द आउटवर्ड मूवमेंट और इनवर्ड मूवमेंट दैट इन एक्टिव or irritate the nerve endings or close to the body of the your odontoblast cells, and these nerves mostly A delta fibers which active होते हैं on cold or hot. ये hyperalgesia or allodynia, that is again very hyper excitable tooth pain होता है when even the local anesthesia not effective. तो ये भी लोकल एनेस्थीसिया में इसकी थ्योरी जो है वो हम कंप्लीट करेंगे. व्हाट इज हाइपरएल्जेसिया और एलोडाइनिया. जो इन्फ्लेमेटरी मीडिएटर्स है ये जो रिलीज होते हैं पल्प में, which make these nerves more hyper excitable, that cannot be blocked with local anesthesia. Vascular supply होती है, और vascularity determine the vitality of the pulp. If the vascularity actually when supply बंद हो जाती है तो pulp goes under the necrosis. Okay, so one question is again here that why when the inflammation of other part of the body we can't remove, then that can be resolved with removal of the cause, that can be resolved. But why where the inflammation involves with the pulp and we need to remove the pulp because cannot be saved. There is a stage what we call the reversible stage, and that stage pulp can be saved, but at the irreversible stage that pulp cannot be saved. So because of this vascular supply, as in nature, as you can see that pulp is present between the heart, एक box root जो very hard है, उनमें इसमें compliance नहीं है कि जिसमें other tissues होते हैं, क्योंकि जो जो आपकी inflammation की signs होती हैं तो उसमें swelling होती है, क्योंकि आपका जो एक्सीडेशन होती है तो उसमें उसकी वजह से देयर इज एक्स्ट्रा वेस्कुलर जो मूवमेंट होती है फ्लूइड की, दैट कॉज द सम स्वेलिंग, और जिसको हम एडिमा फॉर्मेशन और लाइक दिस आप जो भी कहें, तो दैट इज एक्चुअली द हैपन इन द पल्प एज वेल. But when it happens in the pulp, there is no way to resolve it. There is a limited lymph drainage and compliance इतना नहीं है under the pulp. So that edematous mass or the swelling जो होती है that compress the blood vessels further and further decreases the blood supply. So reducing the जो regenerative और जो inflammation के साथ साथ reparative effect होता है, हीलिंग इफेक्ट होता है टिश्यूज में, वो कम हो जाता है और पल्प ऐसा गोज अंडर नेक्रोसिस. So this is how the once it's necrosed, we need to remove it. There's no other way to save the pulp. So the pulp the treatment हम वही कर remove ही कर देते हैं, ठीक है. तो there's a आप देखें other tissue, there's a collateral blood supply. But here again, a limited collateral blood supply. There's a periapical foramen only, and all the vessels are coming inside, and they are inside, closed inside with this hard dentine. So these things are limited blood supply that leads to the you know, necrosis or irreversible condition of the pulp. If there is a collateral blood supply, if there is a rich blood supply to the pulp जो है वो इतना जल्दी फिर नेक्रोसिस की तरफ नहीं जाता. तो दैट्स व्हाई द ब्लड सप्लाई इज इम्पोर्टेंट. संपत्ति नर्व फाइबर्स भी होते हैं और ऑल दीज थिंग्स. तो रेस्टिंग ब्लड फ्लो जो होता है टू द पल्प इज 0.15 to 1.60 ml per minute. That can be reduced with the time with the pulp foramen, with the dentine formation, pulp volume reduce. Coronal pulp, then radicular pulp, because of pulp chamber, the more blood. Greater in pulp horns. This, and this is the laser Doppler flow meter is used to measure the blood flow, not the vitality test, which actually nerves को stimulate करती है. But blood supply अगर pulp की देखनी हो तो laser Doppler flow में यूज करते हैं या ऑक्सीमीटर यूज करते हैं. That is the device to use that. So with the time, pulp reduce होता है due to the calcification and all that. ये हम उसमें आपको मैं समझाऊंगा. Just root apex को थोड़ा सा यहाँ, ये root apex है और पेरीएपिकल, ये माइनर पेरीएपिकल फोरामेन जिसको हम एपिकल कंस्ट्रक्शन कहते हैं, और मेजर एपिकल फोरामेन है. ये जब इंटरनल एनाटॉमी पढ़ेंगे तो उसमें डिटेयली कैन डिस्कस दैट. एंड जस्ट पेरीएपिकल जो रेडिकुलर, जिस एंडोडोंटिक में दो चीजें जैसे मैंने बताया कि पल्प और पेरी रेडिकुलर एरिया. So this is a periradicular area, it's a periapical foramen. There is a PTL and then there is the alveolar bone. So which surround the root apex, that we call the periradicular area or periradicular tissues. And here from the, if the pulp is infected, the infection can spread through the periapical foramen and involve this PDL and alveolar bone, and that we call the periapical periodontitis. And there are different types of the periapical periodontitis. And here you can see a periapical tissues surround the root apex. That is the okay. ये तो पुराना होगा 4th एडिशन, अभी शायद उसका लेटेस्ट है, तो थोड़ा भी नहीं ज़्यादा मेनली हम फॉलो करते हैं. तो दैट इज द बुक यू हैव टू रीड एज वेल. So thank you so much. See you in classroom, hopefully.
So excuse me.
जी.
So वो ना टेस्ट का पैटर्न बता दें काइंडली.
बीसीक्यू होंगे वो अभी आईटी वाले आपकी शायद आज एक थोड़ी सी रिहर्सल करवा देंगे आपसे, ठीक है. तो वो
Yes,
आपको थोड़ा समझ में आ जाएगा. वो आम जनरल बीसीक्यू आपको दे देंगे और उससे थोड़ी प्रैक्टिस हो जाएगी आपकी. तो हमारे भी बीसीक्यू होंगे, आपको बीसीक्यू हम देखेंगे नंबर ऑफ बीसीक्यू कितने देते हैं. तो बीसीक्यू होंगे. और हाँ
सर कंप्लीट ऑपरेटिव तो तैयारी हो ही नहीं पा रही इतनी ज़्यादा.
नहीं हो पा रही.
पार्ट्स यस सर बहुत मुश्किल हो रही है.
कोशिश करें.
सर कोशिश कर रहे हैं बट कंप्लीट नहीं हो पा रही. मतलब वेडनेसडे, कमिंग वेडनेसडे पे अचानक से टेस्ट हो रहा है, तो मतलब इतनी तैयारी हो नहीं पा रही थी. हमने बात भी की थी बट पता नहीं कोई रिस्पॉन्स ही नहीं था.
चलें, इसको कभी आप बगैर उसके भी जो हो डेट दी जाती है तो उसको थोड़ा सा कंसीडर करें आप। इसमें मैंने शुरू में कहा था कि अभी शायद ये लास्ट वीक होगा, कमिंग वीक से तो हो सकता है कि कैंपस जो है वो ओपन हो जाए। तो उसमें तो इस तरह से अभी ये टाइम और डेट जो है फिलहाल यही है, और जितना कर सकें तैयारी करें, कोशिश करें। बाकी देखेंगे,
ओके
अगर
सर।
तो नेक्स्ट जो एक करेंगे हम टेस्ट, वो फेस टू फेस होगी, तो वो फिर कंप्लीट करेंगे। ये एक थोड़ी सी प्रैक्टिस करवा देते हैं आपको, ठीक है? तो जितना
ओके
करें
सर।
आप करें, उसको पढ़ें थोड़ा सा, ठीक है? हो जाएगा इंशाल्लाह।
ओके सर, थैंक यू।
ओके।